In 2017, Yale New Haven Children's Hospital embarked on the improvement of care for patients with autism spectrum disorder. The Children's Hospital teams were providing best-in-class care to our patients and easily treating medical problems we most commonly saw, and many that were not so common. But what about treating the whole patient? The physical, emotional, sensory, and developmental treatment, which was greatly needed for certain populations, specifically patients that had autism spectrum disorder or like diagnoses. We developed a multidisciplinary team composed of pediatricians, child psychiatrists, quality and safety and nursing leaders, certified child life specialists, frontline clinical and medical staff, and most importantly, we reached out to include parents of children with autism spectrum disorder. We held weekly meetings and we looked at our performance data, and we knew we had an opportunity to elevate the delivery of care process for this population. So we worked with families and frontline staff to understand what are the barriers and obstacles. Everything from busy waiting rooms, crowded elevators, sirens, to the need for better preparatory materials, sensory tools, and education about the population and how to navigate their care.
I'm a mom of a son who's 16 years old. He has autism as a primary diagnosis and a few others, and his name is Noah. And he's a really great kid, and unfortunately, when you put the pieces that autism has for anxiety and sensory issues, it can really make life challenging when you're going to the doctor. As he became older, kind of getting into puberty, he began to be much more sound sensitive, so those were triggers for him which would create bolting or aggression or stopping, kicking off his shoes. This past fall, Noah had to be hospitalized. He went through the emergency room and then was admitted in a little bit of time at ICU, and it was such a wonderful experience because staff really seemed to be knowledgeable about the different kinds of things that might impact him, made attempts and to kind of keep him calm and figure out what were the things that might be triggers for him by asking us questions. And they were just much more sensitive to those kinds of issues for him. They had Child Life come in. They clearly were trying to be Noah focused and give him different options about what kinds of things might help and counting, and they offered him some sort of a sensory toy like a squeeze or something like that. Music was one of the things that we used to put on for him, dimming down the lights so it's a little bit quieter. Those things all helped. And why is that a wonderful experience? Well, in the future, Noah might have to be in the hospital again, and I feel that his time here at the hospital really will be something and say, remember when you were at Yale New Haven Children's Hospital and you met this person and they were so nice, and when you were done, you did such a great job and you got to go home. It'll be a really good thing for him to be able to put in his memory bank for the future.
We leveraged our electronic medical record to create a better process in identifying pediatric patients that may need a little extra help or support in these situations. After these patients were screened and identified, a comprehensive behavioral plan would be completed by either the nurse or the child life specialist with the parent or guardian. This plan describes elements that could potentially trigger or frustrate the child, like perhaps white coats or bright lights, but also includes tips for clinicians to help normalize their visit. For instance, how do they prefer to take their medications? What are their favorite foods? It also details successful ways to help de-escalate the patient. What is soothing for them? What does the environment need to be like to create a healing and safe scenario? Once this plan is completed, visual cues are populated in the medical record to alert anyone on the care team that the patient has a behavioral plan, and they should take notice of this before entering the room or providing care. So we worked with our Family Advisory Council to create additional visual cues that we could use on the door as well, as an additional prompt or reminder. In addition to changes to our electronic medical record, our child life specialist worked with our marketing team to create social stories, a photographic journey that details and prepares the child for their visit to the clinic, emergency department or operating room, inpatient admission, or any other hospitalization experience. These social stories aid both the parent and child to ease their fear or anxiety of the unknown or unexpected, but it really helps us as clinicians as well to anticipate the child's needs to a greater extent. Our child life specialists also created sensory toolkits for this population. Child life specialists and nursing often utilize these kits when working with patients with a diagnosis on the autism spectrum or other neurodevelopmental diagnoses. The items in the toolkit each address the needs of a specific sensory pathway, adding or removing stimulation as needed.
Something that really impressed me about the clinical redesign team At the very first meeting, everyone did a round robin introducing themselves and talking about what their specialty was and how they would be coming into contact with patients like my son with developmental differences. You could really tell how much they really cared about their patients. They wanted to do a better job, and they were eager to make changes. And I think that's really why it's been so successful, because the team is really behind the project.
With all of these improvements, we have seen our care delivery process start to evolve. We've heard directly from our families that the care feels different. There's a different level of understanding, a heightened level of preparedness, and the ability to truly help these kids through their challenges, all while providing excellent and safe care.